So today we'll be administering blood. To begin, I will check my orders and confirm my patient and date of birth. Betty Jones, date of birth 5/21/52. I'm going to gather my items. So I do have gloves here, my normal saline, my blood, my tubing, alcohol prep pads, saline syringe, and some Germ-X. Normal saline is the only IV fluid that can be administered with blood, and blood cannot be at room temperature for more than 30, left out at room temperature for more than 30 minutes. So I'll collect my supplies and go to the room, knock, and introduce myself. Hello, my name is Pa Young. I'm your student nurse today. I will provide for privacy. Can you just confirm your name and date of birth for me? Betty Jones, 5/21/52, and check the armband there, make sure it matches. All right, so Betty, my understanding is that you are receiving blood. Yeah, so the doctors come in to talk to you and they've answered all of your questions. Good. And I did see your signed consent here, so thank you for that. Do you have any other questions at all before we begin? No? Okay. So I do have a few questions for you, a few things to note before we get started. So before we get started, once we do start that blood administration, please report to me any changes at all. So if you feel nauseous, if you feel chills, if you have difficulty breathing or any back pain, anything out of the normal, please let me know, okay? So while I am asking her questions, I'm assessing her ability to understand and follow commands. So we did get that consent, and then I'm looking for her IV site, checking to make sure that it's in good shape, so it's not red, swelling, there's no edema, anything like that. And then before we get started, I'm just going to get some vitals from you as well, okay? I'll want to listen to her heart, get her pulses, and also listen to any lung sounds. Everything, if they are in the normal range, will continue. So, I will want to begin with checking my items here, again confirming for Betty Jones. I will want to check my normal saline bag, make sure that there's nothing floating in there, that it's not punctured, check the expiration date, and make sure again that it is normal saline. So I'm doing my 3 checks. Checking my tubing and looking for any kinks, and also making sure that they are clamped before I get started. And lastly, checking my blood. So confirming that it is for my patient and that there are no blood clots and nothing floating in there, no punctures or anything. And so again, blood just can't be left out in room temperature for longer than 30 minutes. In addition to this, I will have a licensed coworker nurse confirm that my blood is for the correct patient. So here, I'll have my coworker confirm. So I have medical record number 224466.
Medical record 224466.
Account number 123456.
Account number 123456.
Patient Betty Jones.
Patient Betty Jones.
Date of birth 5/21/52.
Date of birth
5/21/52.
5/21/52.
And then armband 456654.
Armband 456654.
Patient blood type B positive.
Patient blood type B positive.
Donor pool 7890.
Donor pool 7890.
Units in pool 4.
Units in pool 4.
250 milliliters
250 milliliters.
Blood component PRBC.
Blood component PRBC.
Expiration date 11/21/2022.
Expiration date 11/21/2022.
Donor blood type O positive.
Donor blood type O positive.
And compatibility test completed.
Compatibility test completed.
And date 8/26/2022.
Date 8/26/22.
All right, so I will sign off on that, and then my coworker will sign off on that form as well. So making sure to match that with my patient. All right, so I will wash my hands. And I'm just going to check the IV site and give it a flush to make sure that it is still patent, or that it still works well. So I have alcohol swab here, and I have some tape, so I'm just going to remove that and swab for 30 seconds and throw that away. Connect. And flush. And it looks good. So I'm going to disconnect that at this time. And then I will prepare my saline. So I'll check my tubing, again making sure that I have everything clamped. And I do have ports, 2 ports, and making sure those are clamped. So to begin, I will start with my saline, my normal saline, and spiking my bag. All right, and then I will hang that. And I will want to prime my line once I get it untangled here. So I'll open that. And I'll want to fill my chamber. So I have a filter in my drip chamber here, and I'll want to fill it up to the line or above that filter. So typically it should fill fine, but with this tubing it is reused, but you do want to fill the chamber so the blood that comes through does not hemolyze. And then I will want to prime my line and get out all the air bubbles there. All right, so I have that primed, and I'm just going to set this down. Okay, and then I want to clamp my saline at this time. So making sure I have the correct blood, I will also want to spike my bag. And I'll just want to, you know, tilt it back and forth to mix it up a little bit. Again, just making sure there aren't any clots or anything in there that shouldn't be in there. And then here I'll want to open that and fill my drip chamber. Okay, so now I want to prime my blood. And again, I do have the saline clamped. And once I do see that pink tinge come through, okay, then I'll stop that. All right, so I have this primed and I will now connect it to my patient. So I will grab an alcohol pad and rub for 30 seconds. Okay, so I have my clamps open. Okay, and then I'll put this in. Turn on my pump. So I still have my saline closed, as I do want my blood to run first. And so now I'll want to program my blood. New patient, yes. And patient ID, channel A, I'll do guardrails IV fluids. And then I do have RBCs here. I have yes, RBCs, and then the rate, I want to start with 50 milliliters per hour. So a slow rate just to double check that she doesn't have any reactions. And it's beeping at me. And then volume to be infused. This is a 250 milliliter bag. I will infuse 200 at this time. And I'll press start, open my clamps, and let it run. So again, Betty, just let me know if there's anything different that you feel. Please report any changes, you know, out of the normal, okay? I will throw away my items. So clean up, take off my gloves, wash my hands. I will lower the bed if I did raise it. And then I'll want to stay with her for the first 15 minutes, assessing vital signs, and then in another 15. So the first 15 minutes and then 30 minutes after I started the IV. Just again, checking to make sure that she doesn't have any transfusion reactions. If she does start having any reactions, I will want to discontinue the blood administration right away. I'll turn it off, disconnect the tubing, and per agency policy, throw out the blood and tubing as needed. I will have to report that to the provider and then follow up as needed. I would want to just make sure the patient's comfortable and make sure that the call light is near. Lifespan considerations. The elderly, you know, may, again, wanting to double check the skin, that it's intact, it's thin, and they may be confused, so you want to do more check-ins with them to make sure that they aren't reacting and just aren't aware of it, assessing the vital signs as needed. With children as well, for both adults and children, geriatrics as well, we'll want to cover the blood. There are patients, you know, others who prefer not to see it, so if we want to cover that, just so it's not visible. That also helps as well. And again, with children, just making sure that they are reporting any changes as well, any difficulty breathing, and answering any questions or concerns that they have. I will document when the administration was started and when it was stopped, how much was given, so 250 milliliters, and then how the patient tolerated the procedure, of course. So she tolerated well, no reactions at this time, and then once the blood is completed, I'll want to administer saline, normal saline, as well at least 50 milliliters to clear out that line with blood. And that is it. Thank you.